Hi guys. Today we interview our experts, which is Dr. Nadzra from Hospital UiTM Pucuk Alam. Doctor, can you introduce yourself to our audience?
Assalamualaikum warahmatullahi taala wabarakatuh, and hello everyone. My name is Dr. Nadzra binti Wan Nordin. I am the senior lecturer and a clinical specialist in the Department of Obstetric and Gynecology in Medical Faculty or Faculty of Medicine UiTM.
Thank you, Doctor, for the kind introduction. Okay, let's start with our interview. So, for the first question, what is ovarian hypertrichosis and how does it differ from polycystic ovarian syndrome?
Ovarian hyperthecosis is a hyperplasia or overgrowth of a theca cell in the ovary. Okay, stroma part of the ovary. So in order to understand it, so we shall recall back what cells are there in the ovary. So in the ovary, they have three types of cell: granulosa cells, theca cell, as well as the stromal cell. So these granulosa cells are the one that is responsive to the follicular stimulating hormone to produce estrogen. Whereas theca cells are cells not in the stroma of the ovary, but it is responsive to this luteinizing hormone to produce progestogen. In the ovarian stroma, normally there's only connective tissue disease, but in hyperthecosis, you can see this theca cell that is luteinized, that has this luteinizing hormone. So when they have these cells in the stroma of the ovary, then you have this situation where we call a hyperthecosis. So hyperthecosis, ovarian hyperthecosis, is showing a hyperandrogenism state and also insulin resistant of the patient. So that is what ovarian hyperthecosis is. A bit complicated, but that's what it is. Okay. Whereas polycystic ovarian syndrome is a totally different. I mean, some people can argue that hyperthecosis is the severe form of this polycystic ovarian syndrome, but they have separate characteristic where ovarian hyperthecosis usually happen in patients who are postmenopausal, meaning they are no longer having their period. But polycystic ovarian syndrome are in those who are still having their menstrual period or in their reproductive age. So that is a clear demarcation between ovarian hyperthecosis and PCOS in short. Okay. Another difference that you can see is actually, as I said just now, the hyperplasia of this theca cell in the ovarian stroma is the characteristic of hyperthecosis. Whereas in polycystic ovarian syndrome, the problem, this hyperandrogenism, meaning they have a lot of male hormone we call testosterone, it happens in the periphery. So in polycystic, they have these small cysts that leads to this luteinizing problem, excess androgens. Okay. So what else is a totally different pathophysiology, basically.
Okay. Thank you, Doctor, for your answering our questions. So next question, Doctor. Are there any lifestyle or dietary recommendations available to manage this condition?
So when we talk about hyperandrogenism, meaning this patient with ovarian hyperthecosis, they have more male hormones. So they have like a viralization, meaning their voice becomes hoarse, and then you have acne, and this woman particularly, they will have more facial hair, what we call hirsutism. So all of this is actually associated with obesity, obesity, which is endemic in our population at this moment. Malaysia is the champion for obesity in the Asian continent. Okay. So one thing, the lifestyle is a good diet and prevent from becoming obese. Okay, because as I said, ovarian hyperthecosis can happen and leads to insulin resistance, meaning diabetes is also another problem.
My next question, Doctor. How is the ovarian hyperthecosis diagnosed, and is there any specific test that we can confirm it?
Okay, basically, how we diagnose ovarian hyperthecosis is first the patient will come to you with these complaints of having acne, hirsutism, facial hair. So when we have that and we have a suspicion of excess androgenism, so normally what we do is we're going to send blood to look at the level of testosterone. Usually in women, the testosterone is low. But in these cases, the testosterone is going to be increased, as well as in those who have PCOS. But specifically for ovarian hyperthecosis, the testosterone is super high, meaning it has to be more than 150 nanogram per liter. So that's when we suspect this patient has ovarian hyperthecosis. Next, they can also do another hormone level, that is DHEAS. Okay, but all in all, to differentiate between it and PCOS, the gold standard of diagnosis is actually taking the sample of the ovary and send it to the lab, where they're going to look under the microscope to diagnose ovarian hyperthecosis. PCOS doesn't require this. So the gold standard is actually taking the biopsy from the ovary and send it to the lab to be looked under the microscope. Okay.
Thank you for the explanation, doctor. So we'll move it to the next question.
Next, doctor, for the next question. What are the primary causes or risk factor for developing ovarian hyperthecosis?
It is actually not well understood on why a patient has ovarian hyperthecosis. Some studies or the belief that is a genetic predisposition for this patient to have ovarian hyperthecosis. Another thing, as I have said earlier, obesity is one of the cause for this ovarian hyperthecosis. It's not well understood, but there are beliefs that it is has a genetic predisposition, and obesity is one of the risk factors. Insulin resistance is the problem associated with it. Okay? Alright.
Okay, thank you so much, doctor.
Alright. Thank you very much for having me to answer your question, and good luck for your presentation and submitting this, okay?
Lastly, do you have any advice towards young women regarding ovarian-related disease?
Okay. So when it comes to ovarian related disease, it's never the same for every woman, and it's never straightforward. So my advice would be, if you are in doubt or you have any problem, come and seek treatment from health professionals. I know and I understand now we are in an era of internet and AI. So don't go to Google, because not every cases are the same. Do come, and don't be afraid to be seeing your obstetrician and gynecology. We are very nice people, all in all, okay? Alright, that's my advice. Don't Google your problem, because not all the cases are the same.
3, 2, 1, action.
If you have problems, seek professional help. Don't solely depend on AI.